There's been some discussion about the chiropractor can be dangerous, you know, particularly the neck. I guess there was something a while back, there was a controversy about that. And there's still some chiropractors that won't adjust the neck. Is there any truth to that, or is there, you just got to be a little easier on that particular area, right?
Right, yeah. Well, chiropractic is very safe. It's probably the safest and most efficient and effective form of healthcare there is. And sometimes we get a bad rap, and we've had a bad reputation, which is, it's a lot like playing telephone as a child. You know, something happens, and then as the story passes on, it gets really
worse.
Blown out of proportion.
Yeah.
But, you know, a lot of people are very surprised when I talk about how inexpensive my malpractice insurance is. I think I pay less than $2,000 a year. The reason being, it is very, very safe. Now, if there was any risk to injury or paralysis, or the stroke issue was really hot in Connecticut a few years ago, our liability insurance would be through the roof. We probably wouldn't be able to afford to be in practice, most chiropractors. But it is very safe.
And that is very inexpensive, being in the insurance field.
Right,
That's a low number.
It's unbelievable. I'm in full practice for almost 15 years, and the whole stroke thing, it's really been put to rest. What they feel is, you know, chiropractors were getting blamed for causing strokes, and what they found is that it wasn't necessarily the chiropractic that caused the stroke, but the patient may have gone to the chiropractor with a headache and a stiff neck. We're in the process of having it. They may have gotten an adjustment, go home, the stroke happens. It would have happened one way or the other, and the studies really do show that there's an even incidence of whether they went to the chiropractor or their primary care physician. They went to the primary care physician, stiff headache, they miss it, they go home, have the stroke, same thing with the chiropractor. So it's not necessarily the procedure that was done. And I hate to see the word misdiagnosed, because it's a very difficult thing to the type of stroke that we're talking about to diagnose, but it's been pretty much ruled that it's not something that's, you know, it's a possibility.